This is Dr. Greg Hall once again with Better Black Health, brought to you by Genetic Sequence Multivitamins, still the only multivitamins made specifically to treat African Americans, specifically to meet the nutritional needs of African Americans, and also by the Better Black Health book, which you can find on Amazon and every good bookstores anywhere. Today, we have honored to have Dr. Arthur Bud Burnett, the second MD, MBA, FACS, all those letters. He's a distinguished Johns Hopkins urologist, researcher, and educator whose pioneering work has revolutionized men's health and erectile function, including playing a key role in the development of Viagra. As the Patrick C. Walsh Professor of Urology and the director of the Male Consultation Clinic, he has broken barriers as the first Black professor of urology at Johns Hopkins. Go on with your bad self, my mother would say, and served in leadership roles such as the president of the Sexual Medicine Society of North America. He's a prolific author and passionate advocate. Dr. Burnett has performed thousands of surgeries, advanced minimally invasive techniques, and founded Uro Mission Works to bring urologic care to underserved communities. He's also a proud military veteran, honored for his lifelong commitment to innovation, compassion, and excellence in medicine. So welcome, Dr. Burnett.
Well, thank you for your kind introduction. I hope I can live up to all those things you're saying, but
well, hey, listen, you lived up to them first. But it's great to meet you. Now you're in Johns Hopkins. So you're in Maryland right now.
That's correct. Right here, Baltimore, Maryland.
Born and raised.
Well, I grew up in Washington D.C. So born and raised in Washington D.C. and which is just down the road more or less. But have traveled here and there. With some of my training, although you're right, I have been here at Johns Hopkins since medical school, and that's now going on 42 years or so.
So my goodness. Well, and then one of the premier hospitals in the country. So I know we're gonna get to the important part first. Now, tell us about this Viagra. When they came out with Viagra, did you know it was going to be as big as it turned out to be?
Well, I did not, to answer the question, and I had some sense that yes, anything that has male sexual function in it does kind of get a little bit of attention. I would think,
right?
All those kind of subjects do kind of do. But I trained as a urologic surgeon, and back when I was in my residency, I was just dismayed that the way we went about looking after men was really not the very best. We basically said, okay, if a man came in and said, my function, with whatever kind of colloquial word you want to use, pointing towards his crotch area is not working. We just kind of said, well, let's give you some Yohimbine, and if that doesn't work, we'll put a device inside your penis called a prosthesis and just send you on your way. And I was like, there needs to be a little bit of a hand about how we can improve managing these conditions. Not to mention the fact that I think just in a more holistic way that we've kind of accepted sexual function as a mind-body thing, and it's partly the physical, it's partly how the erection works, but also understanding relationships and these sort of things too, which I certainly promote and support. But the other thing is I just went about the scientific work and found out that the mechanism behind penile erection was a chemical process involving this drug or this chemical factor called nitric oxide. And we figured out the pathway of the erection response, and it was more or less kind of backed into by the company working on a drug for angina called Viagra, but back then they called it UK 92-480 or sildenafil. And it turned out that the guys were kind of saying, wow, I don't know how my heart's any circulating better, but I'm getting better erections, at least in the early phase trials.
Right.
And then kind of the revelation then was, gosh, there's a couple surgeons, scientists in the field, and there are a couple other groups also involved in this, but we had a prominent role. We published an article in Science back in 1992, and I was the first author as a resident surgeon scientist at that time.
Wow, that was a big shot thing, wasn't it?
Yeah, kind of. Science is a big journal. Who would ever thought a urologic surgeon, let alone a training urologic surgeon in residency, who wrote an article to go in and it was published in Science. But basically, that was the foundation for the understanding of the mechanism of penile erection, which I've taken forward with erectile dysfunction management, also sickle cell disease and priapism and disorders, where I'm very passionate about. That we think about our young Black men who are affected by that. So we really understanding the science of erection disorders is kind of where I was going. And along the way, there's been a lot of media attention, I guess.
Yeah. Well, I mean, I think, but it's great, but it's the science I try to really bring forward to my patients, the science behind why blood pressure medicine works, and why microvascular disease, and why diabetes. What your blood, when people can get where their diabetes monitors, ongoing monitors, that revolutionizes how they treat their own diabetes, because they know what they do that brings the blood sugars up. They know what brings it down. It takes all the mystery out of it. So when people, the science, embracing the science behind this stuff is really important, isn't it?
Oh, absolutely, and I think just as you're speaking to you as a physician now, which you can certainly understand on just the level that we're talking, that anything that goes on in our bodies, anything, there's got to be some mechanism behind it. I know sometimes go back several centuries, people kind of had fanciful thoughts about a lot of things, saying some things are controlled by some magic or this or that. Well, you know what? I think we've evolved to really understand anything that's happening in our bodies. Really, there's got to be some sort of it's a mechanism, a biochemical mechanism, some things in our bodies that make the body and the tissues behave in a certain way, work in a certain way. And it's just a
Right.
matter of just saying, okay, let's figure this out. Let's figure out what's going on. And then, of course, in my field, what was a bit of a mystery back in the still in the 80s, really, where I trained, was just nobody really understood erections, and we figured it out.
Right, and that's huge. That's huge. So let's talk about prostate cancer for a minute.
Yeah, sure.
Why why is prostate cancer, and this is so much more prevalent in African American men? You've probably been asked that a million times. I've been asked, and I'm going to see. I'm going to see what your answer is, because my answer is kind of weak.
Yeah, well, I'm sure it's not weak, and you probably have some insight on this. But it's apropos, as this is Black History Month, and it's good that we're talking here and bringing some attention and messaging, positive messaging,
Mm,
because yes, prostate cancer is a leading cancer in the United States among all men. And while that
right.
sounds sobering, I think I want to give a positive message that we need to think about how we address the problem and take action early, because that's when things can still be as favorable as they can be. But to get
Mm,
to your question now, why are Black men disproportionately affected, and what are those kind of numbers? Well, first of
mm,
all, prostate cancer affects about 1 in every 9 men. In
mm,
the Black population, it's about 1 in every 6.
mm,
So that just tells you right there, there's about a 60% higher incidence rate
mm.
in terms of how men do acquire prostate cancer. What's more astounding, though, okay, what's more astounding is that there's a 2.5-fold higher, all right, 250% higher, if you will,
Mm,
rate of death of prostate
mm.
cancer. So the mortality rate is higher. Just for the audience, mortality rate. I
Right.
was explaining
Yeah,
to the
sure.
audience,
Yeah.
but death rate, and so everything's higher. Just it occurs more commonly, but
Hmm.
more profoundly is it kills Black men more commonly. And so
Right.
let's get into it. Why so? Well, there may be at least why it occurs. The incidence relates to genetics. It may relate to what our lifestyle is all about. We may be more exposed to certain kinds of carcinogens, various factors that promote prostate cancer or any cancer developing in the body. I'm sure
Mm.
other cancer rates are higher as well in the Black population.
They are.
Disproportionately, Black men and other minority men, other men of color, may be in different environments that are not the healthiest environments in terms of just environmental toxins, just
Mm,
breathing in the smog, working
mm.
in occupations that may expose them to various chemicals that create higher risk of effects in the body. So I think a lot of that is behind why Black men have a higher rate of getting prostate cancer. Now, why do they have a higher rate of dying? Well, that has a lot of illuminating insights there too, which have to do with access to healthcare, and
Mm.
largely in my mind, and perhaps delayed diagnoses, not being counseled well to get health screenings, and then finding out that they do have really the best care that's not necessarily brought to them, or let's say they've been withheld from being brought to Black men. And I'm passionate about all this, that we need to make sure that we look after our Black men and bring them the best developments in the field.
Right, right. So how big was the PSA? I mean, the fact that we can do a PSA on a
Yeah,
man versus doing a rectal exam, I know that a lot of people stayed away from me, just trying to avoid. I mean, I know you guys are still doing it, but in order to get screened for prostate cancer, PSA is a better test. It's a blood test, and it's been that's been a big deal, I think, in order to be able to screen people with that blood test versus
sure, sure.
uh, doing
The
the
rectal exam. Yeah.
yeah.
Well, there's something to be said about that. I mean, the Black men and their sexual health, is not to be minimized. I think black men in our culture, unfortunately, have been in a way emasculated in so many ways.
So many ways.
Um, so many ways that they're not sensing that they're retaining their best ability to be who they think they can be, their identity as black men. And now we're going to talk about managing a prostate cancer and talking about, finger in the behind, this and that. So, I want all black men listening to this, that I sympathize and understand where you're coming from. Now, the beauty of having this new blood test done, new relatively, because it's been around since 1988.
Right.
So it's been around now a few decades.
Right.
Is this blood test, the PSA, prostate specific antigen, is just a blood test. It's a blood draw, and it can pick up this chemical that's made in the prostate, the organ that's right beneath the bladder in the pelvic area. And it really tells us about the health of the prostate. And like any blood test, kidney function test, liver function test, well, we got a prostate function test, more or less. And then if it's outside the normal range, that the red flags go off, and we need to kind of evaluate what that's all about. But this is the point that I'll leave with you, Greg, is know that, and for the audience, is the PSA test is not infallible for prostate cancer. Okay, know that is really just indicative of something that's just not right with the prostate. It could be prostate enlargement, it could be prostate infections. So if your primary care doctor just screens with a blood test and find that there is something abnormal there, then that should then prompt a urology consultation to try to discern what is the basis of that PSA being outside the normal range, being abnormally elevated. And yes, it's replaced the digital rectal examination to some extent. I know we joke around a lot about this, saying who wants something like that in their behind, but physicians still are well-meaning now, and we check the prostate. We can check for any disorders in the rectal area, so men know that this is just part of a health test, like women get their tests. We do this. But although I would make this additional remark, we do know that the PSA probably 95% of the time, if out of the normal range and we work it up properly, will inform us about the risk of prostate cancer. And less than 5%, probably less than 2% of the time, to be even more strict. Will the DRE, digital rectal examination, provide any unique information? The PSA test is almost always going to be abnormal for us to kind of be saying, okay, let's work this up and sort it out.
Right. I just know that there are people that avoid a physical altogether just for fear of a rectal exam. You know what I'm saying?
Sure.
And what's tying this conversation into the last, what brought men into the doctor was wanting a prescription for Viagra. Otherwise, men stayed away. Right?
Well, maybe that's part of the benefit, the side benefit of having this new treatment for.
Absolutely. So I say, yeah, you can come in and get a Viagra prescription, but we're also going to draw your blood. We're going to check your cholesterol. We're going to check your PSA. We're going to talk about colon cancer screening. We're going to, talk about all those things. And so
men should be attentive to all those things. But I'll tell you about another phenomenon that you may have an interest to hear. Is now that men can acquire these medications online and through these various other services more and more often. I have, at least my personal feeling is that may be detrimental to have these developments, because now men may be losing opportunities to have a good, thorough discussion about their health. So the good and bad of how our culture is evolving, I guess.
It is. And, what's a shame is a lot of my patients are going online and getting these prescriptions, that I don't want to name any companies or anything, but and they're paying more than they would have if I had wrote a prescription for, sildenafil, Viagra, or tadalafil. They're paying more for these online places than if I just give them a prescription and they take it to the drug mart down the street, and now it's $25. It's $20 in Cleveland. You know what I mean?
Yeah.
Let me ask you this now. I've seen a commercial that, not to go back and forth, they combined Viagra and Cialis. It's got a little tadalafil and a little bit of sildenafil, and hugging up on the person because they've got a little bit of both. Is there benefit there?
Yeah. So what's that all about? And you know what? Speaking as somebody who knows this field very well, I've written all the books on it. I've written the science of how this all came to be, and I'm known to be a world authority and talk on these things all the time. The honest truth is, I'll use the analogy. If I pour a little Coke in with a little Pepsi and say, "Here, I got something new for you," is it really something that spectacular? If that resonates with you, that's kind of what that's all about,
right?
And so it's almost more of a kind of a marketing scheme of something that sounds fancy. There is the truth that sildenafil which is Viagra, and tadalafil, which is Cialis, are slightly different drugs in terms of the formulation. And Cialis, the tadalafil, which is the drug name, does have a longer half-life of elimination in the body. So therefore, it does have a more prolonged effect to break down, and therefore it's lingering and may actually register in the penile tissue longer by the way it's formulated. So it may just be that there's some distinction there, but just combining the two, thinking you've got something that's like exponentially more potent, that is just not
there's
true.
there's nothing behind that. So
Yeah.
let's go back to Washington D.C. and
Yeah.
you're thinking about, I think I want to be a doctor. And what was there some sort of an event, or was there some mentor, or what was it that made you decide I'm going to become a doctor coming out of Washington D.C.? Because I was in D.C. back then, and I lived on 1800 North Capitol.
How about that? How
S
about
and
that?
S Street. So what? Tell me about that.
Yeah, I don't think anything is too spectacular. I mean, about any of that. It's just we all have some exposures in life. Maybe we have some aspirations. Some people drop off with whatever they thought they were going to do. I just early on just had a true attraction to science and medicine and just brought in some cultural exposures. Maybe that have through family the notion that somebody was doing a noble job of what a physician's all about, which is care for people and responsible for their lives and having impact. If you have, really that compassion and that passion, maybe well, certainly compassion to it, but have the passion to go through, what it takes to be a physician, which is a lot of schooling and a lot of books and studies and this and that. You know what I'm saying? And some people peel off after a while saying, I just can't do what needed to be done to acquire the knowledge to do that. And I was just blessed with the ability and stayed with it and went from one stage to the next, from high school, exposed to science, thinking that I wanted to be a physician, had a sense a surgeon was what I wanted to do, went off to college and continued in the science field, majored in biology. And then right from there, kind of went on to medical school and just, took the step-by-step process and got to be where I am.
That's amazing. That's amazing. So tell me about being the first Black making full professor at Johns Hopkins. I mean, that's a huge, coming from an associate clinical professor at Case, right? Which is a big deal. I have to live to be 90, I think. But how why are you the first? One of the things that we talk about is that, we're disproportionately take longer to do things. I got people that will join a hospital or university at 38 as a full professor. And I'm like, well, how did you pull that off? You know what I mean? Eric Topol, when he came to Cleveland Clinic when I was a resident, was 36 years old, and he came in as the chairman of cardiology, which was amazing. So how talk about a minute about becoming a professor and how that made you feel. And then should you have been one sooner? And this is no reflection on Johns Hopkins, but just on the situation overall. I mean, what do you think about that dynamic?
Yeah, well, it's a very complex discussion with all that. To answer your question as to, just what it takes to be a full professor, I think that I early on was able to do some transformative things that we've already talked about some of that. And indeed, become a full professor at high level institutions, including Case Western and certainly Hopkins, is that you gotta be transformative in some way, and you've got to be almost, you have to have some impact, and you have to be internationally renowned. These are kind of like some of the key criteria.
Right.
And I was able to kind of do that. I think I was a full professor at 40.
Get out of here! Yeah, so there you go.
Yeah, which was pretty astounding. But the amazing thing about it is I didn't look at it quite in the context of I'm the first Black to do this. Even from grade school, even though I was like the only one Black kid in the class of this and that, I just always kind of looked at, I don't look at color. I just look at, are we excelling as people, and who are we, and what are we doing? And yes, and it's not lost on me that I'm the first Black individual, but it wasn't like that was a purpose. It was just kind of a way that I feel like I need to achieve like everybody else. I need to excel like everybody else. I need to put in the time, no excuses, persevere, but deal with the obstacles. Because you're right, in our society, there are some pathways that are easier on some of us more than others. If you know what I mean. There's a nuanced statement that some have rich uncles, some have had generations of physicians above them, creating pathways, creating positions. Who knows?
Yeah.
And I had none of that because nobody in my family had ever gone into medicine. I was the first even to do anything like this.
Hmm.
So I had to kind of forge away and persevere. But
Hmm.
but uh, but it's not lost on me the impact of it. And what drives me in my career over all the years is just how am I using the talents I've been given to
Hmm.
do the best that I can do. And I realize that as I make these achievements and recognitions, how does it make me feel? You ask that question. The answer is that I am more thrilled, I am more fulfilled
Hmm.
by the journey and by the interactions and the people and lives that I am impacting.
Hmm.
Not a plaque on the wall or just even a recognition, other than to say, and even as a full professor, other than to say that I think it is informative, probably more for people around me than it impacts on me. I want those of us who don't think black men can achieve to recognize that black men can achieve. You and me can achieve. We can achieve and do great things, and we
Right.
can we have a purpose in our society, and we're making advances in our field, and it also hopefully inspires those who are walking behind me as black young men and women to also know that they can kind of aspire and achieve. So how do I feel? The way I feel about it, I'm still very humble about all of it. I just feel
Hmm.
like
Right.
I'm just doing what I'm supposed to do,
Right.
and it doesn't make me feel like people got to bow in front of me or any nonsense like that. It's just it's just that I think that this has been something that's been rewarding, in the sense that I think it's very purposeful that I'm living a life of purpose, and it's hopefully impacting others.
So, well, talk to me, and I'm sure it is. And then, it being an example, I mean, you make it possible. You know what I mean? So
Yeah,
it's like no one's ever done something before. It kind of seems like, well, it's not possible, but you did it. You did it at a young age until you made it possible. And
sure.
I think that makes that speaks sort of speaks for itself. I think it's a wonderful, wonderful testament. So, talk to me about Euro Mission Works and why did why was that needed?
Yeah. So what that's all about is that again, just being thankful for and grateful, the gratitude of my having some training, background, opportunities in life, and then making some achievements with things that yes, I probably made things happen in my life. I mean, nothing just came to me, but I made things happen. But blessed along the way.
Mm,
And I realized that I could have some impact. I mean, one thing that you may know as a statistic is that black men are underrepresented in the physician ranks, and
oh.
in urology, 2% of urologists in the country are black. 2%, two
Mm,
percent. All right, 2%.
mm,
So guys like me need to be. I think we have a responsibility. Need to take on roles of trying to improve. We've gotten to the top of the mountain a little bit. So we
mm,
need to kind of do some things. And what I was doing with Euro Missions Work is a nonprofit humanitarian mission kind of organization. I started primarily working in the Caribbean to
mm,
elevate urology for patient care for individuals who wish to train to become urologists. I was just astounded when I started going down to, let's say, Jamaica, which is where the University of West Indies is, right
mm.
there in Kingston, Jamaica. And I've been doing it for 25 years. They had about 16 urologists for a 3 million population.
Oh
I mean,
my.
there are more urologists at Johns Hopkins Hospital than the whole country of Jamaica. And
Right.
I just said, you know what? Patient care is suffering. We don't have enough good people here. And so in a very, a humble way, not trying to force myself on things, but I started going down there and I was welcome there. And I've been working with their developing young urologists and seeing patients. And I do that about 4 or 5 times a year for like 4 or 5 days or a week at a time.
Mm,
And been doing that for a long, long time. And also travel other places, Africa and other places of need, as a surgeon
mm,
and as an advocate and as an educator and
right.
working with urologists can learn new skills and acquire skills and working with getting others involved and really if you think about it, here in our own hemisphere, if you will, we got the United States, we got Canada, here we are. The Caribbean was still, in my mind, even it's still catching up,
Mhm,
maybe a generation behind in terms of how urology is practiced, and
mhm,
and if you leave Florida and fly to any of these the various destinations in the Caribbean, it's about as quick as going to part of the United States. So it just seemed to me that somebody needed to step up. Somebody had some influence, which I do have. I'm very involved with the American Urologic Association. I'm one of the board directors. I'm involved with a lot of different societies and leadership roles I'm involved in such a way that I can try to make impact and make change. And then through my own organization, Euro Missions Works, we've been able to do some of that.
That's outstanding. Well, it's great, and you don't think about it. I've never thought about how many urologists there are in Jamaica. Probably the same thing in Bahamas, and
Oh,
and
sure.
a lot of people have come.
Bahamas only has 3 urologists for 300,000 population.
Terrible. It's ridiculous. It's crazy. And so to be able to do something about that is outstanding. So now you have a book coming out soon, I
Sure.
guess, and tell us about it, and where should we look for it, and
Yes. Well,
tell us a little bit
just a
about that.
preface is, I've written a couple books: Prostate Cancer, guide here, Johns Hopkins, another one here that's called Manhood Rx. These are books that can be found on Amazon.com.
Mm.
And again, I guess among my list of accomplishments on my resume, maybe is as I'm a bit of a book writer. But I've done a few books, and then my next book is coming out, also Manhood Confidential,
Mm.
on top of Manhood RX, which is just more of a book that just tells men about the basics of their anatomy and their functions, and even something that's valuable to non-urologists who want to pick up and as care providers and learn a little bit about things. But the Manhood Confidential was inspired by what I've been witnessing in the world today,
Mm-hmm.
which is that we need more positive influences about what maleness is all about, what
Mm-hmm.
manhood is all about, what it is to really take charge of your health and thrive, to understand what proper relationships all about, but
Mm-hmm.
just understand really what your sexual function is, and that there needs to be some reality checks about a number of things, despite the influences out there that everybody at age 25 needs to be on Viagra, that everybody
Right.
needs to have prowess that can carry them on for 6 hour, sexual episodes. I mean,
God
we
bless.
we need somebody who's an authority like me, who's a professional, trained in the field, really can talk to this these issues, and even counsel our young men. Young men, I mean even teenagers, about really what should they be thinking about to really be true contributors to society and be men. So this book is going to be bringing in a little bit more of philosophy, a little more culture, a little bit
Mm-hmm.
more bringing my thinking about that. And it's not meant to be judgmental. It's not meant to be self-righteous. It's not meant to kind of put a spin on the fact that everybody needs to get their act together. But it's really just one of these sort of things that to be a man means to accept just your emotions, accept that you don't have to somehow think that you've got to be the next Marlboro man out there, or some other super functioning superhero or something. But just let's just talk about what being men are all about, and that the men can take charge of their lives
That
in certain ways.
that's so needed. It's very very much needed. And what's funny is that I had a person come in 62 yesterday and said he wanted to be a referral to urology for a vasectomy because his 42-year-old wife wants to have another baby. And he's like, I don't know if I'm going to live to raise this child. And I take being a father very, very seriously. And I think,
Mm-hmm.
he's like, if I bring a child, I need to raise them, to not die while they're 15 or, and such. And so not that he's going to die when he's 15, but you have to think about that. If someone my age, having a baby, am I going to see, and it's important. So the responsibility of being a father, the things that fathers tell you, that a lot of people, black men in our community, are not hearing from their fathers to tell them good things because their fathers didn't tell them things. And so there's a lot of culture. And so I think what you're writing about is going to be critically important about the responsibility. I mean, sex is one thing, but being a father and the responsibilities that go along with that are incredibly impactful. So we look
Well,
forward to
absolutely.
getting that.
I agree with you. So that book is coming out sometime this year. Of course, the amazing thing, and of course, I've been talking with agents and my co-writer and so forth, who's a medical writer, who's a wonderful person, is just this that we're dealing with some crazy times right about now. I mean,
You
I
think?
I hope that's an understatement, maybe.
Right.
In terms of just trying to bring messaging, I think is so needed. So we're persevering because we think it's the right thing to do, despite so many other directions and interferences and challenges of what everybody's focus may be these days. But we think that this book coming out here as things settle down, hopefully, and there's some of this the world disorder gets together or resolves. We can kind of say, okay, well, let's get reoriented in terms of things that make sense here. And this this is a makes sense thing.
Excellent. Thank you so much, Dr. Arthur Bud Burnett, extraordinaire, Johns Hopkins, one of the best hospitals in the country, urologic surgeon, veteran, right? You've done it all, and not what you haven't done it all, but you've got a responsibility to community. It's been so great having you on this program. Thanks so much. Are you on social media at all? Should people follow you or anything?
Sure. Yeah. I'm on pretty much everything that's out there. I do work with a publicist who also helps me deal with some of this stuff, just because I've got a day job, being a surgeon,
right.
A scientist, educator, and all the other things. So, but know that I'm welcome communications, and I just want the general public to hear us well. That you and I are doing a great service. You're doing a great service here with your program. So let me congratulate you on that. That those out there hopefully are getting knowledge and can take charge of their lives and live longer and healthier.
Very good, very good. Well, in honor of Black History Month, thank you so much, and hopefully we'll talk soon. Take care.
Absolutely.
None of the statements that I have made have been evaluated by the Food and Drug Administration. Genetic sequence multivitamins are not intended to treat, cure, or prevent any diseases. Furthermore, none of my statements should be construed as dispensing medical advice or making claims regarding the cure or prevention of diseases. You should consult your own licensed healthcare provider before starting any supplement, diet change, or exercise program, especially if you're pregnant or have pre-existing injuries or medical conditions. Remember, having a doctor is always your best option.